Trump's health, three big ethics questions. U.S. President Donald Trump's personal doctor Dr. Harold Bornstein has claimed Mr. Trump wrote his own letter of health during the election and later sent aides to raid the physician's office. Dr. Bornstein now says he fell out of favor with the president after divulging some of Mr. Trump's prescriptions to U.S. media. The U.S. medical ethics expert to detail three of the ethical concerns brought up by these allegations around the president's health care. 1. Dr. Bornstein divulged information about Mr. Trump's prescriptions. The New York Times, which first interviewed Dr. Bornstein about Mr. Trump's health last year, said the doctor willingly volunteered facts about Mr. Trump's health. He told the Times that Mr. Trump took Propecia as a treatment for male baldness, a common antibiotic for rosacea, a statin for his cholesterol levels, and a daily aspirin. In the U.S., medical records and related medical information are protected under a privacy law known as the Health Insurance Portability and Accountability Act, HIPAA. The law states that the only people who can see a patient's medical information without explicit permission are the medical staff involved with treatment and those processing the patient's bills. Dr. Arthur Kaplan, professor of bioethics at New York University, said that Dr. Bornstein could have violated HIPAA, a federal law, by sharing details about Mr. Trump's prescriptions. It has big penalties, Dr. Kaplan added. 5 years in jail, a $50,000 fine. Trump's doctor said these drugs are trivial, but it's not on the doctor to decide that. 2. Dr. Bornstein now claims Mr. Trump wrote his own letter of health. In a recent CNN interview, Dr. Bornstein said a 2015 letter suggesting that Mr. Trump would be the healthiest individual ever elected to the presidency was not his professional assessment. Trump wrote own health letter, doctor says. Dr. Bornstein said that Mr. Trump dictated the letter to him. It raises the issues that, as with any celebrity, it's dangerous to ask their doctor to evaluate them, Dr. Kaplan told the BBC. He added that to him, the letter doesn't look like anything a doctor would write. Celebrities and powerful people tend to use people that will do what they want, so ethically, it's always a conflict of interest. You shouldn't expect an honest answer. In light of these allegations, Dr. Kaplan said he believes the U.S. needs a new system for examining presidential candidates. Using an independent board of doctors rather than just the candidate's personal physician, he said, would help address these ethical issues. 3. Dr. Bornstein alleges his medical office was raided for the president's medical records. The New York City-based physician told NBC News he was visited by one of Mr. Trump's personal bodyguards, whom he identified as Keith Schiller, and 2 other men at his office on February 3, 2017. Dr. Bornstein said the president's aides took the original and only copy of Mr. Trump's medical records, including lab reports. While the White House has insisted the incident was not a raid, and was just standard procedure, Dr. Kaplan told the BBC it is a doctor's right to keep a copy of patient medical records. Trump in excellent health, White House. The debate over Trump's mental health. In the U.S., medical records are joint property, Dr. Kaplan said. They do belong to the patient who can have a copy, but the doctor keeps one too because if an issue comes up about malpractice, they have to have the record. You can't just come in and take away everything. Dr. Kaplan noted that because Mr. Trump's aides did not provide a letter from Mr. Trump himself requesting the information, their taking possession would be illegal. You can't have a president sending people out to pull records, it's an abuse of power, Dr. Kaplan said. It hasn't gotten the backlash in the states that it should. Trump's personal doctor acted very unprofessionally, Dr. Kaplan added. And we still don't know if Trump is healthy or not.